What do we think of when we think of family? We now begin a 3-week discussion about family systems therapy models, and today we'll focus on structural family therapy. We'll also learn a new and important way of conceptualizing cases from a family psychology perspective, and this should be helpful to you as you begin to conceptualize the family therapy clients with whom you work in your clinical practice. Now, the principal architect of structural family therapy is Salvador Minuchin, and before moving on, we want to look at the global aspects of the systemic models, which approach problems practically rather than analytically, and identifying stagnant patterns of behavior within groups or families. Each of the models we study will discuss specific ways in which therapists introduce unique and creative nudges to support the changing of the stagnant family system. Here's the mind map for the structural family therapy model. Now, for our case review, we'll explore the Roberts family. Please pause the video to read about this family and notice how you can tell some of their family dynamics by where they sit in the therapy room. Now, when we think of structural therapy, we think of the family as having an invisible set of functional demands. Minuchin believed in using compassion and humor in the therapy setting in order to join the family as a way to better understand the conflicts they were experiencing. So let's move on to central constructs. There are 4 main constructs that are central to this model: family structure, coalitions, subsystems, and boundaries. Family structure includes rules that determine who talks to whom, who plays with whom, etc. And when individuals come together to create a new family, they tend to maintain remnants of rules and interactional patterns from their families of origin. What might be some of the non-spoken rules that govern the Roberts family? Now, the next central construct is coalitions, in which 2 or more members join together. It could be any member or set of members, but interactional patterns are critical. Are these members joining to crowd someone out? Maintain a family secret? And these patterns tend to maintain the family structure for better or for worse. Now think about your own family structure. Are there coalitions? If so, how do they impact your current family interactions and dynamics? Next, there are subsystems, which are smaller groupings within the family that tend to be parental and sibling-based. At this point, how would you differentiate between coalitions and subsystems? Remember that coalitions can be any grouping of members, while subsystems tend to be grouped by parents or siblings. Now, the final construct is boundaries, and according to structural family therapy, boundaries are rules that specify who participates in the coalitions and subsystems within a given family. They can cause dysfunction in how family members relate to one another. You can have disengaged or rigid boundaries that occur due to a lack of communication. A high sense of individuality is encouraged. Then there are enmeshed boundaries, which are unclear or blurred. Because of the ambiguity involved, they can cause intense transmission of stress, and conformity and loyalty are expected. Because of the secrecy involved, some families with an alcoholic member may have an enmeshed boundary structure. Healthy boundaries occur when rules and roles are clearly defined and communication is open, though not overly so. Think about the boundaries among members of the Roberts family. Would you describe them as healthy, disengaged, or enmeshed? How did you come to this conclusion? One idea is that their boundaries might be enmeshed in some ways because of the intense level of stress that some members experience. Now, I want to introduce a new way of conceptualizing cases. It is a systemic paradigm from the family psychology model involving 3 tiers: intra-individual, interpersonal, and environmental macrosystemic factors. First, the intra-individual tier encompasses aspects pertaining solely to functioning of the individual, and we'll look at 4 aspects of this tier: development in context, personality, cognition, and diagnosis. Development in context represents the client's outlook or worldview as shaped by their upbringing, culture, spirituality, family patterns of communication, etc. Pause the video to review the remaining 3 components, and we'll then apply each one to the Roberts family case review. Let's consider Shante to be the IP or identified patient. Her outlook or development in context would be in terms of her African American heritage as shaped by her upbringing. Her personality, which is her ostensible presentation to others in terms of emotions, attitudes, and behaviors, would be aggressive and characterized by acting out behaviors towards others. In terms of cognition, Shante may have difficulty processing her environment. She may consider it to be unsafe and therefore may act aggressively to protect herself. Diagnostically, she may suffer from a disruptive behavior disorder such as ADHD or oppositional defiant disorder. She may be taking medication to manage her symptoms, which impact her functioning both at home and at school. Now, the second of the 3 systemic tiers of the family psychology paradigm is the interpersonal tier, which encompasses the family life cycle, parent-child relations, family process, and social networks. Here are the 4 components as they apply to Shante's case, so pause the video as needed to review. In regards to her family life cycle, which focuses on emotional and intellectual stages of development, Shante may have had difficulty navigating these stages and may lag behind other children her age. Parent-child relations may be strained, and she probably interacts differently with her mother, who is more assertive, than with her father, who is more passive. Communication among family members, or family process, tends to be aggressive as evidenced by frequent arguments that occur. And her social networks may also reflect friends and relationships with others who are aggressive. Others may expect a certain level of toughness from her as well. The final tier of the paradigm is the environmental macrosystemic component, representing the aspects that impact us on a more global level than the other 2 tiers. They include culture, and in Shante's case, she is African American, SES, which for Shante's family could be hypothesized as middle class, physical environment, and we would assume that she has been raised in a house, but would also include the physical environment of her neighborhood and community. In terms of religion, we know her family is Christian. Both parents are employed, and Shante attends school, and media global aspects that might impact her, such as societal stereotypes about children who act out. Other factors might include perceptions about her faith background and identity. Now, please realize that some of these factors, such as culture, are so complex that they also impact the client on intra-individual and interpersonal levels. So you see how the intra-individual interpersonal and environmental macrosystemic tiers work together to create a thorough template for assessing the important factors that underlie the functioning of our clients. This systemic paradigm can ultimately be a valuable tool for case conceptualization and treatment planning. Now, from what we've discovered so far, hopefully the goals of this model will make therapeutic sense. First, we want to alter the dysfunctional structure of the family to promote healthy relationships and the ability to solve future problems that occur. Additionally, we want to facilitate growth on an individual level while also preserving and fostering mutual support among family members. Ultimately, we want to restructure and reorganize systems, like the coalitions and subsystems mentioned earlier, to eliminate the presenting complaint. So what interventions do we use to accomplish these goals? We use a three-pronged strategy of focusing on the family structure, zeroing in on the system and the complaint, and highlighting communication patterns. Let's look at this more closely. For the first strategy, focus on family structure, there are two prominent interventions. The first and most salient of the structural model is joining the family. This is when the therapist essentially becomes a member of the family to better understand its structure. In doing so, the therapist works to change the hierarchy within the family and encourages members to work together to solve problems. In the therapy video this week, see how Salvador Minuchin symbolically joins the family and works to unbalance and change the power struggle involving the mother, father, and young son, who are all part of a blended family. Now, these are actually the very first words you hear in the therapy video, so please pause and consider how he attempts to understand the role of the parents as he begins to join the family. Also note that during the video, he changes seats to get a better perspective of relational dynamics. Now let's consider that you are the therapist for the Roberts family. When joining them, what dynamics might you become aware of? And what impact would unbalancing this family have on the therapy process? One idea is that Jane might automatically expect that you will encourage Derek to take a more active role in the disciplining of Shantae and Christopher. Now, the next strategy, which is to zero in on the system and complaint, involves three interventions. First, enactment, or bringing the problem to light directly in the therapy room. Also, focusing, which is choosing the most important elements of the problem to focus on. Then reframing to help the family see the problem in a different light. With the Roberts family, the enactment of a behavioral outburst with Shantae in the session would be helpful to invite the therapist to observe the problem as it happened. Eventually, we would focus on how Derek and Jane respond to the outburst and how this problem tends to escalate. As a result of this escalation, coalitions might emerge among family members that could be visible to the therapist. Now, throughout this process, we would use the reframing technique to help the Roberts see the symptoms in a different light. In acknowledging Shantae's outburst, for example, we might tell her, "Shantae, your angry feelings may be your way of showing mom and dad the pain you're feeling inside. Let's work on ways to help them hear you more clearly, and perhaps we can all communicate better when that happens." And finally, we want to highlight communication patterns, and one intervention involves paradoxical techniques or prescribing the symptom. An excellent example appears in the final chapter of Yalom's book, Love's Executioner, in which Yalom asks Marvin to phone his wife every 2 hours. This technique, as you may remember, helped Marvin and Phyllis to solve a crucial problem in their marriage. Now, as you think of the cultural implications of structural family therapy, consider the important task of joining the family and how this would impact a family from a different culture, or a blended family, or even one from your own culture. Please reflect on the following ideas, such as asking permission before moving on. When we think of the process of therapy, according to the structural model, there are generally 4 steps. First, the therapist joins the family and works on defining the presenting complaint. For the Roberts family, this would involve addressing Shantae's challenges and how they impact each member of the family. Next, we highlight the problem-maintaining interactions. And for the Roberts, how are family members interacting in a way that perpetuates the problems? For Jane, it may be bearing down hard on the children, while for Derek, the solution may be to back off and let members cool down on their own. Now, the third step would be to explore alternate ways of relating while recognizing and even emphasizing family strengths. This process could involve recognizing Derek's ability to react to tense situations with a cool head and without getting angry. We might work with Derek to help other members take on this quality of interacting so that all members could approach solutions with clearer heads. And finally, as progress was made over time, the therapist would reduce his or her role from joiner back to observer. Now, if we draw a treatment plan from this process, it might look like this, and pause the video as needed to review. Now, we tailor our structural therapy treatment plan to the needs of the Roberts family. And remember that we ultimately want to promote more functional communication styles among family members. On a spiritual level, a powerful example of family dynamics can be found in the parable of the prodigal son. Please pause the video to review and reflect on this story. Over the next few weeks, we'll be taking a close look at each family member, and today we'll start with the father. For our upcoming class discussion, consider his part in the story and also consider the dynamic that occurs when a parent appears to show more love to one sibling than another. Have a great week.